Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, today we have a very special guest from Indonesia, Dr. Dyah Febriyanti. Thank you so much for joining me here today. You are going to be speaking very soon here at our Gold Learning Summer Day, and all of you can go online actually right now and check it out. You need to head over to goldlearning.com and check out our Summer Gold Learning Day to see all the amazing presentations that are coming up. You're going to be talking about from Galactocele to getting breastfeeding on track, get breastfeeding back on track, I should say, a clinical case study. Now, of course, I've seen a little bit of this presentation already, and I'm very excited to say that, this is a topic I feel we just don't get enough opportunity to really discuss and talk about. And I think, in my humble experience of working with families is often the galactocele can be misdiagnosed. But perhaps you can tell me a little bit about, you showcase some complex cases and such. Have you, when you first talk to a mother and you see this, Dyah, are the mothers surprised what it is? Because it seems that sometimes it might be not as challenging, but other times galactoceles can cause quite a few other problems as well. So tell me a little bit about your experience of when you first tell a mother that this is what she has.
Hey, thank you, Fiona. It's an honor for me to speak at Cold again about the galactocele. Frequently, I see the mother with a referral before from another IBCLC because I work in a team in hospital. So that's why I frequently see the mother that's having previous counseling. So
Mm-hmm.
that's why they are already keep in mind that they are having an issue in breastfeeding and more ready to hear from me.
Sure.
But actually, there is a concern that usually they have it's like a malignancy. So that's why if I confirm that this is all a galactocele, they are a little bit relieved.
Mm,
But if there is a painful complaint or maybe another like mimicking other diagnosis, that's a little bit challenging for me to make sure for them what to do next, like
mm-hmm.
this. So that's why in breaking the bad news, I have to counsel the family also. That's why I play it in a slow pitch, not in a rush to tell her about what is this. I speak to her slowly. I observe the technique of the breastfeeding. I explore as much as I can about the history of the breastfeeding. That's why, in this case, I obtained the information about her previous breastfeeding for
Right.
the two other siblings. So that's why I answer the diagnosis first before I say to her what exactly is,
Mm,
and then I say it to her in a good manner, in a slow pace, so she is not hesitant to face it, and
mm.
then the family support make her calmer. So that's why it is easier for me to work with such a supportive family and team. So that's why I don't work alone. Have the
Yes.
family and the team. It's so much easier. This is the key.
This
Okay.
is the key. Yes, I was
Yeah.
just gonna, that was really my whole follow-up to this was that you are definitely an example of amazing teamwork. And as you mentioned, most of the time you're getting referrals, people are coming in to see you. They've already seen someone or they already have the
Mhm.
problem, and so forth and so on. I can say that, with my experience, I have found that it's been a little bit tricky, because we don't have a unit like yours, specifically
Mm.
with because you're a unit of, doctors, all lady doctors, as you say,
Yeah.
women that work together, which is absolutely amazing. And you're also IBCLCs, so you're set up really well, for
Mm.
these cases, when they
Mhm.
come in. And
Mhm.
I can see the benefit. I think that, I think it's inspiring. It's inspiring to
Mhm.
see that. Tell me a
Mhm.
little bit about, sometimes when you're counseling family members or the women that are breastfeeding. um,
Mhm.
in my experience, I have seen some women who have become very frustrated if, repeated aspiration hasn't worked, or it's taking more time than expected. The baby's not attaching very well, and they have felt depleted and sometimes have wanted to stop breastfeeding because they're so overwhelmed. Tell me, is this something that you have faced, with some of the women that you have treated as well?
Okay. First, thanks to my senior colleague, Dr. Asti Proverini, who created and founded this team. Again,
Mm-hmm.
the team is the key. For the mother who has, yeah, like recurrent milk cyst that aspirated frequently. Actually, I have found some cases that the mother has seen the not supported surgeon that told her to stop breastfeeding altogether. But
Right.
every mother who came to us is the one who eager to keep breastfeeding because
Mm,
we are in a hospital. The one who came to us is the one who desperately want to breastfeed.
mm,
This thanks God I'm in the tertiary.
right.
So that's why I frequently see the advance because I'm working with the senior.
Mm-hmm.
So I only assist the Dr. Prabor in most times. That's why there is a less frustration in a mother because she feels secure with my
Mm,
senior. That's why. But if I work alone in the clinic outside the hospital, I will face the mother who desperately want to stop breastfeeding. Yeah,
mm,
I'm rarely I ever found one or
yes.
two, but I encountered that the root of the desperation is not only the surgery, no, but the lack of the family support and other comorbidity like postpartum depression. The one that I talk about in the gold lactation this this year, and also this case I want to present if it's possible in the other or upcoming gold if it's accepted in abstract. There is a case that where's the mother with an abscess, breast abscess,
Mm,
and also postpartum depression. This is
mm,
the most frustrated case I ever find. So that's why if you ask me about the desperation, uh, in this field, I work with the senior who tackle the difficult task for me. That's why it's a lot more easier. For the aspiration, actually, the surgeon I work with is preferred to do the general anesthesia.
mm,
But
interesting.
because the aspiration needle is rarely uh, done in the office because this the recurrency. like
Mm.
this.
Oh, the
So that's
recurrence.
why,
Yeah.
yeah, because of that. But in another country, maybe it will be the most effective one because it's the different setting. But in my country, the open excision is the preferred one by the
Mm.
surgeon I work with. Yeah,
Yeah.
that's why I'm not facing the recurrent because of the ineffective aspiration.
Yeah, no, and it is very interesting, even looking at, the different countries and perhaps, how it might be dealt with. But I do
Mm,
sense that, the undertone is that you need to have good collaborative care, good
mm,
support at home, and essentially good follow-up. And there could be comorbidities that need to be identified
yeah.
in the whole situation as well. So
Mhm, mhm,
even though you might be dealing with a galactocele,
mm.
depending on how many steps that parent has made before they
Yep.
get to you, is
Mhm,
they're gonna face some of those challenges as well, correct?
mhm. Yeah, that's correct. You
Yeah.
get the point, actually.
Yeah. Well, it's really lovely to have you here at Gold, and we love hearing your cases. You've got some great cases coming up with this presentation with the Galactocele, which, really showcase, anatomically what you did with the ultrasound. I mean, the pictures are
Yep.
beautiful. Thank you so much for sharing really all of that content, because you take us from the very first time you see this parent right through to,
Mhm,
recovery, and the video showing attachment with the infant, which is so important. All those
mm,
steps, are
mm.
really so important, and need care and follow up. And it helps us identify, the needs of the mother and the parent while they're breastfeeding. Thank you again, Dia. It's been lovely having you here today.
It's my pleasure.
Yeah. Well, thank you again to everybody listening in. As I mentioned, this is such a wonderful topic, the galactocele. And of course, Dia is going to be talking about it coming up here at our Gold Learning Summer Day. You can head over to Gold Learning right now and check out all the details. Register for this event. Dia is going to be with us live on the day as well, answering all your questions. So make sure you bring them. We know that you've got cases that you're dealing with, that you've also struggled with, just like we have. From Galactocele to getting breastfeeding back on track, a clinical case study by Dr. Dyah Febriyanti. Thank you so much, everybody, for joining us here today, and we will look forward to seeing you all very soon. Bye bye for now, everyone.